Hi, hi everybody, and welcome to the National Hispanic and Latino ATTC's webinar, Familia Adelante, an effective substance use prevention and stress reduction program for Latino adolescents at Behavioral Assessment, Inc. I will tell you more about him in a little while. During today's webinar, all participants will be muted. The audio will be streamed through the computer, so please make sure your computer speakers are turned on and up to hear today's presentation. I'm going to review a few housekeeping items with everyone. If you notice that your viewer does not fit your screen, you can expand it by clicking the expand button located in the top right corner indicated by the red arrow. That your viewer is expanded to fit the entire screen. Also, you can collapse the GoToWebinar toolbar on the right of your screen by clicking on the small red arrow to the left of the toolbar. You can click the arrow again and expand the toolbar again, and it will expand. As I mentioned, for today's webinar, all participants will be muted. As we move through the presentation, if you have any questions for our presenter, we ask that you use the chat box on the toolbar. Simply type your question and hit send, and we will, at the end of the presentation, we will allow a few minutes for a discussion of the questions. A recording of today's webinar, along with the PowerPoint slides, will be available at our website, www.attcnetwork.org/Hispanic Latino. Approximately 1 week from today, you can also find recordings and PowerPoint slides from all of our past webinars at the same URL. Also, one NADAC, one MBCC, and one ICNRC CU is available for those attending today's live event. So if you're interested in obtaining CEUs from these organizations, simply email us at hispaniclatinoattc@uccaribe.edu. Today's webinar is sponsored by the National Hispanic and Latino ATTC. As of October 1st of 2012, the network has been restructured and now consists of 10 regional ATTCs, 4 national focus area ATTCs, along with the network coordinating office. As you can see by this map, the ATTC network regions were realigned to better fit the current HHS regions. So you'll see on the left that you have there the 4 national focus area ATTCs. Today's webinar is the 6th in a series that we're doing on evidence-based practices for Hispanics and Latinos. The ATTC network is funded by the Substance Abuse and Mental Health Services Administration and serves a critical role in improving the health of the United States. The network achieves this by translating, disseminating, and promoting the adoption and implementation of evidence-based clinical practices and strives to improve the health and wellness of individuals whose lives have been impacted by the disease by substance use disorders. So you can learn more about the network's products and programs by visiting attcnetwork.org. As I mentioned, the ATTC network is funded by SAMHSA. SAMHSA strives to reduce the impact of substance use disorders and mental illness on America's communities through its programs and services, and demonstrates that behavioral health is essential to health, that prevention works, treatment is effective, and people recover from mental and substance use disorders. If you want to learn more about SAMHSA, you can visit their website at www.samhsa.gov. Now I'm going to introduce our presenter, Dr. Richard Cervantes. As President and CEO of Behavioral Assessment, Inc., Dr. Cervantes provides the managerial, financial, and operational leadership of the firm. He serves as a senior executive and principal investigator for the firm's engagements and provides direction for all the marketing and administrative tasks of the company. Dr. Cervantes is a leader in his field. He has nearly 25 years experience in the field, of mental health and HIV/AIDS research and program evaluation. Sorry. He pioneered the application of statistical analysis and epidemiological techniques for Latino and other multi-ethnic populations in a community health environment. Dr. Cervantes has contributed significantly to the development and sophistication of a body of knowledge to address complex health and human services issues using scientific-based solutions. He received his PhD and master's degree in psychology and his bachelor's in business administration and psychology from Oklahoma State University. His past teaching and academic positions include the University of Southern California Department of Psychiatry, the California Professional School of Psychology, the University of Oklahoma Department of Human Relations, and the California State University at Northridge. His professional and clinical experience consists of forensic consultation and staff positions at Didi Hirsch Community Mental Health Center, the Oklahoma Department of Corrections, and the Children's Medical Center. He began his career as a research psychologist at the University of California, Los Angeles Spanish-speaking Mental Health Research Center, School of Medicine, Department of Psychiatry and Behavioral Sciences. Dr. Cervantes is well published with over 40 publications, articles in mental health and HIV/AIDS areas. He has completed more than 20 individual advisory engagements and as an evaluator research consultant for numerous governmental agencies, community-based organizations, and foundations in the last 3 years. He has been a member of numerous professional committees, including the Hispanic High Risk Cluster Group, U.S. Center for Substance Abuse Prevention, CSAP, Substance Abuse and Mental Health Services Administration, SAMHSA, State Incentive Grant, Evaluation Guidance Committee, and CSAPs. So also I want to let our audience know that if anyone is interested in receiving training in the Familia Adelante prevention model, you may contact us or you may contact Dr. Cervantes directly at bassessment@aol.com. Okay? So now we're going to do our poll questioning so that we can get to know our audience. Okay.
Si puede imprimir. I'm sorry.
Okay. Can I give a computer a few seconds? Okay. Something is happening here. Let's see. Here we go. Do you currently serve Hispanic and Latino populations with substance use disorders? Is our first question. And we have 69% yes, 31% say no. The next question. Okay. Are you planning to serve Hispanic and Latino populations with substance use disorders in the next 6 months? And we have 79% say yes, 18% don't know, and 7% no. What is your current professional role? So we have 19% social worker, case manager, 45% counselor therapist, 12% faculty research student, 7% government official or policymaker, and 23% other. What type of setting do you currently work in? Okay, we have 11% academic, 39% treatment, 5% research, 26% government, and 21% other. We have other questions. This is our pretest. The acculturation process does not include stressful life events. This is true or false. And 100% say false. Familia Adelante has demonstrated previous outcomes related to changing community policies and norms. And 100% say yes, true. Familia Adelante can be implemented by paraprofessionals as long as they are trained. And we have 97% say true, 3% say false. Okay, so again, I want to thank you, and I want to remind everyone to please submit their questions to our chat box, and we'll be happy to take a few minutes at the end of the presentation to answer some questions. So now I'll leave you with Dr. Cervantes with the Familia Adelante.
Thank you very much, Dr. Orovic. And on behalf of Behavioral Assessment, we would really like to thank the National Hispanic Latino ATTC and SAMHSA for providing us the opportunity to talk a little bit about Familia Adelante. And so would also like to thank all of you who have joined in and taken time out of your busy schedule to be part of this webinar. And I'm going to assume, Daris, that you can see my screen.
Yes, we can see your screen.
Thank you. So I will first say that the research that supported the evidence related to Familia Adelante was funded through the National Institute of Health, and specifically the National Institute on Minority Health Disparities. And we'll talk a little bit about that research as we move along. We have about 40 minutes, 45 minutes, and then I want to make sure we have plenty of time for question and answers, and we get everybody on their way within the hour as we had promised. This is a mural that was done by one of the, actually a couple of youth that participated in the Familia Adelante about a year ago in Southern California. We really like the mural because we think it reflects the spirit of La Familia, the multi-generational aspects of Familia, and it was something that we thought was nice to at least keep in our PowerPoint as reflective of the positive experience that some of the kids had. Today, the purpose and objectives of this webinar: first, we'd like you to become knowledgeable about risk and protective factors in the Latino community as related to substance use and behavioral problems. I'm sure many of you are equally as familiar with these issues as I am, but we want to make sure that we're all sort of on the same page. Secondly, we want to learn about the underlying stress theory and the research that is the basis for Familia Adelante. So we all know that if we are holding the program out as evidence-based, we want to make sure that it has a good theoretical basis and that it also has some data to back up the fact that we're saying that it works. So we also want you to gain knowledge and skills in the implementation of Familia Adelante. So we'll give you a brief overview of what's entailed in the 12-week curriculum. And finally, we want to help you to determine if your site is ready for training on Familia Adelante implementation, supervision, and evaluation. And as Dr. Orobig mentioned, one of the goals of the National Hispanic Latino ATTC is to not only provide you information about these evidence-based practices, but really to encourage you to move towards implementation and evaluation of these practices. As you all know, there are very, very few programs and practices that are out there that are specific to Latinos or for Latinos or built and tested by Latinos. So we want to make sure that we get the program out and that those of you that are interested in implementation, in fact, can do so. And we'll talk a little bit about that at the end. So what do we know about Latinos in the United States? And again, this may be very much of a repeat for some of you, but we know that our population is expected to reach 1/4 of the total population by 2050. We know that Latinos are the fastest growing adolescent population in the country, but we also know that Latinos are at disproportionate risk for things like health problems, including cardiovascular disease, some types of substance use and alcohol misuse, sexually transmitted infections, including HIV, and mental health problems, particularly depression and anxiety. Behavioral risks among Latino youth. Our program really focuses on youth ages 10 to 14. In this population, within certain segments of the Latino youth population, there are high prevalence of conduct problems and drug use. Conduct problems and drug use impede normal adolescent development. We know that conduct problems and drug use can lead to other high-risk behaviors such as unsafe sex and other more complex issues that are difficult to treat. There's some other behavioral health issues that I wanted you to be aware of. The Centers for Disease Control finds that suicide attempts among Hispanic adolescents are significantly higher than their Caucasian and African American peers. Suicide attempts are particularly high among Hispanic Latina adolescent females. And there's some new research that suggests that acculturation gaps within the family and differences in gender-based family demands are thought to fuel this kind of adolescent suicidal behavior. So this is very much a health disparity. It's something that in Healthy People 2010 and now coming out in Healthy People 2020, that depression is certainly an issue that is more common than we'd like to think, particularly among young girls. So many of you have heard of the term acculturation. What is acculturation and why is it a risk? Well, acculturation, and I don't have the first bullet here, but acculturation is that psychological and behavioral process that occurs when an individual or a family from one culture comes into contact with another culture. That process is called acculturation. For those individuals that have, good resources and good coping skills, then that acculturation process is a lot less stressful. However, as you see in my first bullet, acculturation is strongly related to drug use and other health problems. On the other hand, ethnic pride and traditional family values can protect youth against cigarette use and other types of substance use. Discrepancies between children and parents' level of acculturation has actually been linked to intentions to use drugs and to family stress. And we know that poor parenting practices negatively impact the acculturation process. I like this slide because it shows on the left-hand side the level of acculturation, and then on the axis with the title time, it shows that as time moves forward, there's a differential effect or differential impact that families have in terms of acculturation. Youth in general tend to acculturate. They become not only more Americanized, but they tend to lose their own cultural orientation quicker than do adults. And among young males, the research shows that young males tend to acculturate the most rapid or most rapidly. Whereas among parents, mothers are the ones that tend to acculturate less quickly over time. So these intergenerational acculturation differences have been found in some very recent research to impact family well-being, youth substance use, and other kinds of behavioral problems. Specific to Latinos or Hispanics, we know, for example, that immigration-related stress and acculturation stress is predictive of higher drug use and risky sexual behavior. These findings are important in the context of racial and ethnic disparities in health, given that minorities report more exposure to chronic and acute stress than do non-Hispanic whites. So why is Familia Adelante effective? Well, you've heard a lot about the research on stress and acculturation. You've seen that in some cases, Latino youth are at higher risk for things like depression and substance use. Familia Adelante has been developed specifically to address many of the stress, acculturation stress, and minority-based stressors that youth and families experience. We began developing these programs when I was at UCLA way back in the 90s, and looking at how to build healthy coping skills among immigrant families. The program has now become more encompassing of all Latinos. The program helps youth and families develop a self-awareness about being culturally and racially different than the majority population, and it promotes problem solving and family communication. One important study that we've conducted that has really helped us tighten up the Familia Adelante curriculum was the study called the Hispanic Stress Inventory for Adolescents. We were able to identify 8 key domains of cultural stress among Latino kids. This is based on a large sample of close to 2,000 youth in 4 large cities across the United States. The first major stress area that kids identified was family economic problems. The second area, as we have discussed, is acculturation gaps. That is, gaps between the acculturation levels of children or kids and their parents. The third type of stress is cultural conflict. That's often found in school-based settings. Another area of stress that kids identified was immigration stress. Many of the kids in our large study were immigrant youth themselves and had experienced a great number of stressors related to not only migrating to the United States, but also the stress of leaving family members behind, including parents and other caregivers. Youth in our large study also indicated that discrimination stress was very salient, very powerful for them, particularly again in the school setting. Youth also mentioned that there were issues around family immigration stress. So even non-immigrant youth reported that their family struggled with somebody else in the family who was dealing with immigration. Youth also discussed the issue of community safety and gang violence and the stresses associated with that. And finally, our youth reported family-related drug use as causing a great deal of stress. So these 8 key domains of stress were statistically validated and have been used to help us fine-tune our 12-week Familia Adelante program. I'm not going to go into a lot more research here because we're running, watching the clock, but significant to say that the Hispanic Stress Inventory Adolescent study found that higher stress scores were highly related to depression and behavioral problems among Latino youth. For males, the acculturation gap was associated with suicidal thoughts, and discrimination stress was associated with suicidal thoughts and self-harm behavior. For females, family-related drug use and the stress associated with that was also associated with suicidal thoughts. And as I had mentioned, the HSIA, the Hispanic Stress Inventory findings, have been used to adapt the Familia Adelante program, and those findings have been published. So Familia Adelante really uses a stress illness paradigm as a framework for behavior change. We target those 8 culturally based stressors that we identified in the previous slides. The program was designed to reduce cultural stress, not specifically address behaviors, but really to work on coping skills, family management, parenting skills. It was developed as a family-based intervention. In one previous outcome study, and again, I told you I would share with you some of the outcomes because it is important that you know that we do have evidence that the program works. We studied 153 youth who were referred to the program because they were having early signs and symptoms of behavioral and emotional problems, including early experimentation with substance use. Those kids and their parents were recruited from a middle school in San Fernando, California, which is a suburb of Los Angeles. Youth were included if they were Latino, ages 11 to 14, with a behavioral or school problem and or an academic problem, not related to language. So what did we find? In the pre-post outcome assessment, we found significant improvements across a number of areas. We found reduced past 30-day drug use in kids that participated in the program. We found increased perceptions of harm in terms of the use of alcohol and drug use. We found reduced conduct disorders, reduced learning problems, reduced hyperactivity, reduced anxiety among the kids, and improved parent knowledge regarding drugs, HIV risk. We would be happy to share these publications with you upon request so that for those of you that are more academic inclined, can look at some of the published results. So now to Familia Adelante itself. How does it work? Familia Adelante is a risk prevention and early intervention program. It consists of 12 English or Spanish language 90-minute modules for at-risk youth ages 10 to 14 and their parents. Familia Adelante targets known risk factors affecting risky behaviors such as acculturation stress, low self-efficacy, social norms or peer pressure, family stress, and all these topics that are addressed from the perspective of Latino families. Each session is logically connected to the previous session, and as such, Familia Adelante is meant to be presented in its totality for participants, for parents and youth. And so basically what happens is that we work with schools, community-based settings, YMCAs, other youth-serving organizations. We help staff understand or identify those kids that are having early behavioral problems within that age range. We then receive referrals. We get parental consent. The parents have to be willing to participate as well as their children, at least one parent or primary caregiver. Once those criteria are met, we actually began the program itself. Parent and youth groups are conducted by trained paraprofessionals like promotoras and other prevention specialists. Parent and youth groups are run separately in either English or Spanish and typically comprise of about 8 to 10 participants in each group. These are weekly groups. We usually do these in after-school hours. We have done some programming on the weekends to accommodate parents' work schedules as well. We have one youth manual and one parent manual that are used to guide each session, and in those manuals we include goals, objectives, and homework assignments. And we do give recommendations for a pre and a post evaluation, which we highly recommend if you're implementing this program, or if you're familiar with evaluation, your funders may want to know, what you're doing and how well is it working. We have some evaluation tools that are available, and we recommend that those are used as well. This is sort of just a visual for one of the programs that was implemented recently in Santa Ana, California, which is in Orange County. It's just south of Los Angeles. And this was what we call a family night. So the last night we have a family night where we bring both the parents and youth together. As you can see, we have 2 prevention workers present at that particular session. So let's talk a little bit about the sessions. I'll go through these quickly. Session 1 is introductory. Here we provide families with a clear understanding of the Familia Adelante curriculum, its purpose, and the need for program evaluation. So it's really sort of a getting to know the parents and the kids. And the first half of this session is done with all the families present in one room, and then we take a break and move the kids into a separate classroom at that point. Again, these are done weekly, and they last about an hour and a half. Session 2 we call concept building. Here we help the folks define prevention and its application in life. We help build rapport with the family group members, acknowledging Hispanic Latino culture as a positive resiliency factor. And we help parents and kids learn the basic concepts of stress and coping. Lesson number 3, we label feelings. Here we help youth and parents explore physical and emotional feelings and explain how feelings can affect behavior. We help youth and parents learn how to be more assertive in their relationships and basically more communicative in general. One of the things we see in our families is the breakdown in communication, not only between the parents and their children, but also between the parents themselves. Many of these parents just simply have difficulty asserting themselves or sharing their feelings effectively with other family members. Lesson number 4 is a stress overview. Here's where we get into the issue of acculturation stress. What is stress, how it affects us physically and emotionally, and how stress affects our health overall. Week number 5, we really focus more on acculturation stress, talk about what it means to be Hispanic or Latino in today's culture, today's society, talk about Hispanic acculturation stress, how to identify the consequences of the physical and emotional aspects of acculturation stress, and what the values are that both parents and youth may hold. One of the things that we really work towards in Familia Adelante is bringing or building an appreciation in youth for the fact that their parents are traditional and do have some strong Latino traditional values. We also help or attempt to help parents understand that their youth are growing up in a very modern, fast-paced, technologically based society. And so they're learning a lot of things about being American in a much more rapid way. So it's simply helping both parents and youth build that appreciation for each other. Lesson numbers or week 6 for youth, and I'm only putting up the youth sessions now. For parents, we focus more on economic and occupational issues in week 6 and 7. For youth, we're really focusing here on school-related stress, helping identify the stressors that are related to school and how this stress affects youth. Help youth identify trusted adults to share their stressful experiences. Interestingly, one of the things that we found in the large study that we discussed earlier, Hispanic youth are feeling very disenfranchised, or many youth are feeling very disenfranchised in their school settings. They're feeling sort of unappreciated, and they're feeling that their culture is not really being respected by school officials, school teachers. Also within the school setting, youth are reporting very, very high levels of intercultural and interracial tension and conflict. So week 6 is we found to be a very important lesson for kids to help them begin to identify those things, talk about those issues, and develop some healthy coping skills. Similarly, in week 7, negative peer pressure, we help youth develop adaptive ways of coping with peer pressure and stress, how to cope with dating peer pressure, and how to address issues around sexual behaviors, particularly unwanted sexual behaviors. Week 8, family stress. Here we help youth identify family stressors, effective ways to deal with these stressors, positive and negatives about engaging in sexual relationships, and we explore acculturation gaps. I might say also that for our younger groups, we typically have 10 and 11-year-olds in 10 and 11-year-olds in groups that are separate, and for those, we ask the promotoras and the prevention specialists to make sure that the kids are ready to discuss those issues around HIV and sexual risk-taking. And typically, for those younger age groups, some of this material is left out. Week 9, gang prevention. Here we really we use a lot of materials from local Los Angeles Police Department and other gang and prevention specialists. Talk about gangs, violence, and the importance of not becoming a gang member, how to deal with peer pressure around the gang issue, and sort of the consequences of gang membership. Week 10, we focus specifically on substance abuse education. This is for both parents and kids. We provide specific drug information, the dangers of drug use, how to promoting other healthy behaviors and activities, facts about drug use, the effects of drugs on the physical and emotional part of well-being, and we discuss the cultural pressures of using alcohol and other drugs. In some segments of our Latino culture, unfortunately, alcohol use is sort of become associated with family celebrations, and so we discuss that. We talk about how to make healthy choices when alcohol is present during those kinds of cultural celebrations. Session 11, family communication. Here we actually bring the families together. We have some exercises that help families build their communication skills. We revisit the acculturation gaps that parents and youth have, and we carve out some time for both parents and youth to actually share some of their feelings, learnings, and experiences that they've had over the past 11 weeks in Familia Adelante, what they've learned about their family and how they intend to use that information to be a better child and or a better parent. Week 12 is our post-evaluation session, and we typically have a graduation ceremony where we give parents and youth a diploma or certificate of completion, and we oftentimes ask parents to, it's like a potluck, we ask parents to bring their favorite dishes, and it's not only a fun final activity, but a nice way for parents to network and to exchange information for future communication. So I know that's a lot in terms of a quick overview. Again, as we mentioned, we have very detailed facilitator manuals that break down each of these sessions in terms of specific goals, activities, objectives, and exercises that we encourage the facilitators to use as a way of getting these points across. A little bit about facilitator skills. We highly recommend 1 or 2 facilitators for parent groups. They should be bilingual. We recommend 1 or 2 facilitators for the youth groups, particularly for the older youth groups. Sometimes these kids, because they are coming in with some behavioral and emotional issues, a group of 10 youth can be a handful for 1 facilitator. So it's typically good to have 2 facilitators present, one that can sort of be the monitor and sort of keep kids within their boundaries in terms of group rules, and the other that can lead the group. But again, we have done these with 1 facilitator in smaller group settings. Facilitators should have at least 2 to 3 years of experience working with Latino youth or families. They should have some knowledge of child development and family processes. And for sure, they need to be familiar with the Latino cultural norms, beliefs, customs, and practices. We currently are implementing Familia Adelante in a controlled fashion, that is, with evaluation, in 3 sites, including Tucson, at Amistades Incorporated, which is a nonprofit community-based organization in North Tucson. We're also implementing through the Jackson County Mental Health Services, that's in Jackson County, Oregon, and also in Atlanta, Georgia at SEPTA Incorporated. I want to make one point here that these implementation sites, these particular sites went through Familia Adelante training in April and May, and then have now implemented with the new school year. So they're working closely with school-based settings to recruit youth to be in the program. One very important thing in terms of sustainability and how they're paying for this is that both Jackson County Mental Health Services and the SEPTA Inc. in Atlanta, Georgia have actually gotten approval from their local mental health authority to bill for these services through their local county mental health contract. And they're treating these as group counseling. We know that there's another group that has gone a different route, a group that was trained earlier that was able to secure approval for Familia Adelante to be reimbursed as a drug prevention program through their local county drug and alcohol program office. So there are different ways to think about funding Familia Adelante, different ways to leverage local funding, and it's simply a matter of having those contacts, making those linkages, and establishing or making folks knowledgeable that this program is out there, it's available, and that it does work. We've gone through quite a lot. We've just, to summarize, we've discussed the background research on Latino kids and youth, some of the behavioral and emotional problems that are prevalent. We've talked about acculturation and the importance of looking at differences in acculturation between parents and youth. I've shared with you some of our findings from a recent national survey on cultural stress among Latino adolescents. And we've talked about the Familia Adelante program itself in terms of who it's for, how it operates, if you will, and the content that's involved in the programming. So at this point, I'm going to turn it back over to Dr. Orobig to lead us through the questions and answers.
Thank you, Dr. Cervantes. Thank you for your presentation. Can you hear me?
Yes.
Yes. Okay, perfect. So we have a few questions. The first one is, so you mentioned that there is a manual and that professionals can be trained in Familia Adelante. How would someone go about coordinating a training for implementation of the program?
So as we mentioned, there is a training available, and the training is 2 full days. And I do a lot of the training. I also have some master trainers that do the training. We train large organizations, small organizations. We've done multi-organizational training. But it is a 2-day training on site, and then we do provide post-training follow-ups or like coaching sessions to help with the implementation. So once the training's done, we want to make sure that you're okay, or that the agency is okay with implementation, and that whatever we can provide in terms of technical assistance beyond the actual on-site training, that's available. As we mentioned earlier, if anyone's particularly interested in receiving the training, if you'll send either me an email or an email to the National Hispanic Latino ATTC, Dr. Orobig, we will do the follow-up with you.
Perfect. Thank you. Another question, do you have any experience applying the model at local churches?
We did recently do a training with a faith-based organization in Dallas, and their plan is to use Familia Adelante in conjunction with another faith-based parenting training program. So we do have some experience with that. However, we're still working with that organization to fully implement the program model.
Okay. Thank you. So another question, you mentioned in one of your graphics that youth male tend to acculturate at faster rates. Do you have an idea of how that happens, or why that happens?
I can only say that young boys in general, developmentally, they tend to be a little bit more impressionable, and or they seem to be more willing to, let me put it differently, they're much more affected by peer pressure and wanting to be like their friends, right? So we think that may be part of, why Latino youth, male youth, acculturate more rapidly, or they have a desire to be much more, like their American counterparts. But that's not my particular area of research. I would be happy to provide that Santisteban and Mena paper where that graph came out of.
Okay, thank you. Also, you mentioned that you receive referrals from school settings. Um, let me see. So you mentioned you receive referrals from school settings. Is there a particular way that they do referrals? Because you also mentioned that you provide some type of orientation regarding
Yes.
who to refer. So how does that work?
So typically, once we have a relationship with a school, in this case, they're typically middle schools, we will go and make the presentation to the school principal or superintendent and or school counselors so that they are fully aware of what the program is about, and they know that it's an early intervention and prevention program. We then, once they agree to implement the program, then we provide them some additional training on how to do the outreach and recruitment and which types of kids we're actually looking for to participate in the program.
Mm-hmm.
So one of the things we found is that a lot of schools this is not a traditional clinical treatment program, like an individual treatment approach. So school personnel need to know that, that the program will work for kids that are just beginning to show signs and symptoms of behavioral problems, but it should not take the place of a clinical treatment program if that is needed.
Mm-hmm.
But we do all that kind of background work. We have information sheets, orientation materials, as well as consent forms that are used to help recruit parents and youth through those school-based settings.
Okay, great. The other question is that you mentioned in one of your studies that you did, you showed changes in mental health symptoms. Did you use a mental health measure, and if so, which one?
Yes, we did. We use the Connors behavior rating,
Mm-hmm.
the
Yep.
parent version. So those mental health reports are based on, or those mental health data are based on parents' ratings of their children's behavior.
Okay.
It's a standardized measure
Mm-hmm.
available.
Yes. Yes. Okay. Perfect. We have a couple questions regarding the cost of the training, but we can refer those participants to you so that you can speak about, because I know that it has a cost, but you can discuss that with them. Is that the best option?
Yes, that's probably the best because it depends on how many people would be trained and where the training would take place and things of that nature. So please have them contact us.
Okay, we'll do that. Let me see. We have another question. If you have done any work in Puerto Rico?
I'd love to do work in Puerto Rico, but todavía we still haven't gotten over there to do our programs. So, but we'd love to see this implemented in Puerto Rico.
Okay, good. So I think that's it for questions. Let me see. Yes. And yes, we have an organization that's interested in the training, so I'll put you in contact, okay?
Yes.
Okay. So thank you again, Dr. Cervantes. Okay, so as we are almost finished with our webinar session, I'd like to take a moment again to thank you, Dr. Cervantes. We really appreciate your time in doing this presentation, and hopefully we'll get more trainings in Familia Adelante. And to our audience, just a reminder that a recording of today's webinar, along with the PowerPoint slides, will be posted on our website at www.attcnetwork.org/Hispanic Latino. Here's our website. So this concludes our webinar for today. Please look at our website to learn about future webinars, and as you leave today's webinar, you'll be directed to complete a brief survey about your experience. Your feedback is really important to us, and we appreciate you taking the time to tell us what you thought of today's webinar. So, gracias. Thank you, everybody.
Muchas gracias.
Gracias.